welcome everyone to our Food for Thought speaker series. Speaker series has been running since this summer. Really happy to have our EMPA alumna here, Gibbons. And today she'll be discussing increasing access to public benefits amidst the pandemic, benefit data trust and integrated approach. Just some quick instructions so we can keep this running smoothly. If you have any questions, please keep them to the end. You could raise your hand in the participants tab and also put questions in the chat and we will get to them. Please keep yourself on mute.
Now, yes, whoever's knocking things over, please put yourself on mute.
All righty, yes, please keep yourself on mute unless you're asking a question. So thank you everyone for being here, and I'll hand it off to Bill so he can do the formal introduction.
Well, welcome again, everyone, and just thank you, Jeremy and Valerie Zimmer for being the point people on this series. I think actually from a technical point of view, we started in the late spring. It wasn't even summer yet. So we've been going for a long time. I urge you, if you haven't been to the website, to go there. Every speech and discussion is there. Papers are there for most of them. I strongly recommend Bridget's paper, which is truly excellent and educational, as well as a policy document. So I strongly recommend it. It's great to have her with us as part of our family. She's been part of our family. And she, for me in particular, as an advocate for cross-sector partnerships, has been working on cross-sector partnerships for the last 5 years. So she's out there doing what social value investing talks about. So we're very proud of her and her work and her relationship to us. And the topic for today couldn't be more important as we hopefully start to emerge out of this shadow of the COVID epidemic and slowly but surely return to normal, figuring out how we can do better in the future and how we help and care for our whole society. If we don't realize by now how we're all in this together, literally, I don't know what will bring those who don't see it to the realization. I think pandemics have a way of ignoring race, creed, color, economic status, age, and public health crises really show how the collective is critical to the individual and vice versa. You can't have one without the other. So that's what Bridget writes about in very factual detail about things we can do to do better. So thank you again for being with us. I don't want to take any more of your time. And I'm sure everyone is going to really learn a lot today and maybe have some insights on how we can do even better than Bridget's already doing. So it's all yours, Bridget.
Thanks so much, Bill. Appreciate it. Yeah, truly, thank you for the invitation. It's such a pleasure to be here speaking with all of you. I hope you're well and safe as can be. Great to see some EMPA faces, Bismarck and Jeremy and Professor Yumi, and thanks to my teammates for joining and some of my family members as well, and others who took some time to be together virtually. Appreciate it. Before I forget, we will talk about the policy paper a little bit later, but I want to make sure due credit is given to my teammate, the author of the policy brief. That kind of gives a window into the work that we do on a policy and practice level. That's our policy analyst, Jess Manili. So she's a fantastic member of our BDT team. I do have a deck, so I'm going to go ahead and share that. One moment. Okay. Can everyone see this PowerPoint? Yeah. Okay, great.
Got it.
I have done that ineffectively many a time on Zoom, so thanks for that. Okay, well, yes, like Phil said, I, had the ability to be a member of the EMPA community. I graduated in 2019 at a concentration in urban and social policy, and while I was in the program, I was working at BDT. So certainly a hallmark of the program and was my experience is that, our professional work being brought into the classroom benefits our classroom discussions and vice versa. The ability to have that kind of space to critically process the work that we were doing that can be so fast-paced day to day was really a privilege. So yes, thank you again to SEPA for a great couple of years and the incredible coursework and connections I was able to make there. Okay, so Benefits Data Trust, BDT. We are a national nonprofit, and this is our mission here. As Bill mentioned, this lends us to very interdisciplinary cross-sector work, but we really are focused on this problem of public benefits access. So we were founded in 2005. We are headquartered in Philadelphia, but we have outreach projects going on in 6 different states across the country, including New York City. So I am actually based here in New York City, working on our New York-based projects and partnerships, along with my teammate who's on the call, Jermaine. We kind of are the boots on the ground for our New York operation. So today what we're going to cover is just a little bit of first context setting, probably something that is not news to really anyone at this time. To Bill's point, before the pandemic, millions of Americans struggled to make meet their basic needs, and unfortunately, sadly, tragically, that we're seeing is a continued and heightened challenge for many. So that's really the water we're swimming in right now when we think about social programs. Good news is there are public benefits that exist that are effective at addressing certain needs that are critical for folks to be able to stabilize in times of economic shock. And that's really where BDT comes in. We have a particular vantage point on how to address this problem of access to public benefits. Okay, so like I mentioned, even before the pandemic, and there's an estimate that 46 million Americans had challenges meeting their nutritional needs, not having enough food or not having enough nutritional food on a day-to-day basis. These 2 charts are actually taken from a study from the Columbia's Center on Poverty and Social Policy, which was highlighted in a really fantastic New York Times article a couple of months ago rather. And there are a couple important things going on here. What we're looking at right now is the poverty rate, which I'm sure many are aware, but how this metric works is that we're looking at the percentage of people who fall under an income threshold. It's calculated every year by the federal government. So as a baseline for a family of 2, the poverty line is about $17,000 a year annual income. So this chart on the left is showing, again, what percentage of the population is below that threshold over time. And we see some really striking things here. First and foremost, we see even before the pandemic, incredible disparities among racial groups, ethnic groups, in terms of proportion of the population under the poverty line. In March, we see a blip. Things get a little bit better. That's actually the subject of this paper and could be a presentation on its own. This is when the stimulus checks went out. The CARES Act distributed funds to every household in the country. And this is a very promising data point to see that poverty went down for that short amount of time, but with a quick uptick to some of the highest rates we've seen in a long time, again, with those disparities between groups getting even worse, exacerbating structural problems that we knew were already there. This chart on the right is another look at the poverty rate, or rather folks in deep poverty, which I think this paper defines that as 2 times or half as much income as the poverty line typically is. We see a stark jump again after the stimulus checks went out to levels higher than we've really ever seen in some time. So again, this is a sad picture, but a true one about where we are and the challenges in front of us as it relates to just the basic needs of day-to-day life. So a paradigm that Benefits Data Trust, BDT, we take is to think about the social determinants of health. I'm sure that this is not a new idea for many on this call here, but when we think about the social determinants of health, we're able to make connections that aren't always clear when we think about things like the safety net or social programs. The social determinants of health, there's a growing body of academic literature that really emphasizes and reframes how we think about health outcomes and overall well-being. Somewhat counterintuitively, this body of work suggests that healthcare itself is not responsible for the majority of health outcomes. It's the social and economic factors as well as health behaviors that really have a disproportionate outcome, or rather impact on overall health and well-being. So those are things like income level, education level, et cetera. That 40% where that arrow is pointing, that really is kind of where BDT and other like-minded organizations are honing in. What are the social and economic factors that are really impacting someone's experience as a person in the world, their health, their well-being, and their livelihood? So, when the social determinants of health are not being met, they're not being addressed, what we see are trade-offs. People are making choices between these various sectors of different needs. In our world, in the social services world, we have a saying, it's heat, treat, or eat. Sometimes people are making these choices between paying for prescriptions one month, paying their utility bills another month, paying for nutritious food another month. So these are just some stats that kind of show what that really can look like. And obviously sacrificing certain needs in favor of others is a real challenge when we're thinking about the overall social determinants. Oh, I forgot to say at the top, Jeremy mentioned this, I welcome your questions throughout. I can't see all of them coming in. If you're putting them in the chat, I welcome you to do so. I'd be happy to address them at the end. And look forward to a conversation at that point. Okay, so building off what I was just sharing, about these trade-offs, these choices when we're thinking about the social determinants, the good news is that there are resources available to try to meet those needs that arise. Public benefits is kind of an umbrella term. You'll hear folks say the safety net, the social safety net, public programs. These are all programs that have developed over time and are administered at different levels of government, federal, state, and local. And what's really unique about the American system of social programs is that they tend to be specific to particular needs. So here are some categories. It's not a comprehensive list, but I think this shows the breadth of different programs that exist out there. I'll highlight a couple that folks might be familiar with. SNAP, the Supplemental Nutrition Assistance Program, is kind of referred to as the crown jewel of the public benefits sphere. It's administered by the federal government, or rather the money, it's funded on a federal level, it passes through to state and local governments for administration. That program, it's formerly known as food stamps. It is dollars that a qualifying household gets every month to use at a grocery store on specific types of foods. It's broad categories of foods, but there are qualifications. The benefit comes on an EBT card, like a credit card that you can use at the store. And it's a benefit that is well studied and well documented in terms of its real impact on stabilizing households and helping them meet that nutrition need. But again, SNAP can't be used for anything like paying your utility bills. That's why there are programs like the LIHEAP program, the Low Income Home Energy Program. That's a program that helps people pay for the utility bills. It comes in kind of an annual amount. In healthcare, there are some programs that folks might be familiar with. Medicare and Medicaid are insurance-related programs. There are some supplementary programs that support with prescription needs specifically for seniors or individuals with disabilities. But again, the picture I'm trying to paint here is that these are all disparate programs with few exceptions. Even if you qualify for a bunch of these programs, there's no way to apply just once and get enrolled in all of the ones that you're eligible for, at least now. And so I think that's important to understand. Also, a differentiator is that these are means tested programs. They are not universal programs. So not just everyone receives them. You have to go through various processes, which tend to be different from program to program, in order to prove eligibility and receive the benefit for a specific amount of time. So to carry this through, again, we've got all these programs out there, and we know that they effectively address the social determinants of health. This has been well studied. Actually, BDT has participated in some of this work of documenting the impact of different programs. These actually, the top two stats I have here about SNAP are studies that BDT led and in partnership with research institutions. Because again, we know, kind of anecdotally, we know from working with folks how important the SNAP and other benefits can be, but it really is powerful when we can quantify the impact of receiving these public benefits on things like health outcomes and addressing specific social determinants. So this kind of just, this is a selection of different studies that are out there. The Wic program stands for Women, Infants, and Children. It's related to the SNAP program, and mothers with children under 5 can receive that benefit if they qualify based on their income to pay for food and formula. So again, this is good news. Public benefits, we know, and we are able to document that public benefits effectively address the social determinants of health. And I think there's even a way of thinking about public benefits as an economic stimulus. There's lots of studies around that. One here is that in a way, an investment in SNAP for people who qualify for it, especially during times of economic shock, there are more people who qualify. We can see close correlations between job creation and also, dollars moving into the economy. There's another study that I didn't put here that, $1 in SNAP in the recession generated $4 in the economy. Again, just because of folks using these dollars in their local grocery stores and getting that money out the door to feed their families. So just a little bit more background. This might be familiar territory for many, but public benefits applications have a couple of steps. Again, because they're not universal, you don't just automatically get public benefits. You do have to complete a process in order to start receiving them. So first, you have to submit an application. Depending on the benefit, there are different ways to do this. More and more applications are available online. This is something New York City has done exceptionally well. I think are kind of leading the pack nationally. There's a lot that you can do online, which works really well for some people, not as well for others, but is an option. Most all applications have paper processes that you can go through and fill out like a form. After you submit the application, you often have to conduct an interview with an agency caseworker. So someone who works at the state, federal, or local agency that administers the benefit will walk through the application with you and verify any outstanding information or the veracity of the information that was entered on the application. From there, you'll need to supply documentation that confirms everything that you discussed and put on your application. So, basic things, identity, address. It can get a little bit complicated about documenting income. There are very, discrete requirements for different programs. Certain income counts for some programs and doesn't count for other programs. Same with expenses. So there are really nuanced rules to follow when documenting your application. And then if you're lucky enough to enroll, you're not enrolled forever. You have to recertify. I think the longest time you can be enrolled in most of these programs is 3 years if you're a senior or an individual with a disability. For SNAP, folks are recertifying every 6 months to 12 months. So that it really is something that people have to be on top of, and understandably is a challenge to remember that you have to do that periodically. So as that description probably started to illuminate, there are a lot of barriers to accessing these programs. And here are a few I'll kind of speak to. Before you even start to apply, you have to know that these programs are out there. That slide I showed with all of the 40 some benefits, I certainly don't know every program that exists that's administered in this city, but not this city, that is in this state and works this way, but works differently in a different state. There's just a lot of complexity, and understandably, folks aren't aware of all of the benefits that they're eligible for. Then there is that whole application process. Some of them, there are streamlined processes in place. A small silver lining of the kind of effect of the pandemic on this system is that we've been able to experiment, or I should say administering agencies have been able to experiment with some flexibility around application processes to kind of remove some steps or shorten some steps. So that's good to see. But in normal quote unquote times, it can be a challenge to understand the requirements and to comply. Mobility certainly is a challenge for some. Some benefits will require in-person visits. Sometimes you need to drop off your documents in person, or even if it's not a requirement, that might be the most expedient way to comply with application requirements. So mobility presents a challenge. And then certainly there's a lot of stigma around these programs. I think there's a lot of myths and misconceptions about how they work. And certainly some shame associated, or perceived shame for some folks about raising their hand and saying that they need this help right now. So that can be a challenge to overcome. Technology, I think, is very helpful in this space. We're seeing, again, New York, I love to shine a light on a lot of the work that New York City agencies are leading the way in developing technological tools to apply and comply with application requirements. But technology can be as much of a barrier for some as a help to others. So certainly we work with lots of seniors for whom, jumping on the app isn't their favorite way to solve the problem. So technology, I think, makes the list. Because of these barriers, millions of households don't enroll in these programs. And again, it's not a question of the need not being there. It's those barriers that I expressed. So here's kind of some stats to paint that picture. BDT and others are really invested in trying to understand where these gaps work and kind of slicing the data to understand where gaps are more prevalent than others. For example, it's safe to say that among seniors, we see higher participation gaps or lower rates of participation in programs like SNAP, in programs that help folks pay for prescriptions, for example. So we really need to be thoughtful on a population level and be as specific as we can about the barriers that each group faces. So this is where BDT comes in. Really, we developed our approach in response to the barriers that our founders kind of knew about and what we've learned over time since we started back in 2005. So I'll just kind of explain this a little bit because I think that's a unique thing about our nonprofit is that we do blend various strategies to address a really complicated problem. So I'll start here at the top right. Direct service is kind of our term for that one-on-one work. A trained professional, they don't specifically need to be social workers, but have a lot of social work skills. A trained professional, we call them benefits outreach specialists, works one-on-one with clients to help them complete application processes. So the direct service really is the heart and soul of our organization. It's the majority of our staff. The majority of our resources really go to this work of accompanying people through really challenging processes and overcoming that barrier of lack of knowledge or lack of awareness about the programs that exist. I'll speak a little bit more to this in a bit, but something to highlight is that even before the pandemic, we provided our services over the phone. That is different from how a lot of similar organizations operate. We kind of see the public benefits access landscape as a constellation. There's a lot of different approaches that are needed. There are fantastic organizations, especially in the city, working in trusted communities, appropriately staffed with language, like folks that speak the community's preferred language, that have a great connection to the residents there. And, they are a fantastic resource. But again, we do our work over the phone just as an option for people who aren't connected to in-person assistance. And certainly that's proven helpful during the course of the pandemic, where everyone has had to rethink what it means to serve their clients remotely in most cases. Another piece of the strategy is our partner engagement. This is really my role and my team's role, is to work with a variety of stakeholders to make sure our solutions work. In particular, we need to understand different administering agencies' processes, priorities, limitations, goals, so that we can tailor our solutions to something that's helpful for them. In an ideal world, the assistance that we're doing over the phone is actually making caseworkers' jobs easier. And so, if we're completing applications and making them very thorough and helping people who are really eligible to apply, we hope that saves, government agency caseworkers time. So that's really something that we're attuned to. We work a lot with community-based organizations because there's a lot of way to advocate together and to build coalitions. And increasingly, we've been working with healthcare plans and providers because of that social determinants connection, because of the clear impact public benefits receipt has on health outcomes. We have been working with healthcare plans to help their members enroll in programs. We do have kind of a data and technology backbone to the work that we do. For example, in our contact center, we've developed a proprietary screening and enrollment tool that people use while they're on the phone to guide the conversation and ask the required questions of what are very complicated programs. And in addition, we do a lot of targeted proactive outreach for which we use various data sources to identify people likely eligible for these programs, but not yet receiving them. And then last but not least, certainly is our policy and practice work. Because we do this work across the country, we have thousands of conversations with individuals every day. We start to notice some trends, things bubble up, in terms of what could be better about these systems overall. And so the memo that Bill highlighted, that was written by my colleague Jess, she's a member of our policy team. They are really thoughtful about how to package and work with different partners to recommend solutions based on what we see on the ground. So this is just a little bit about kind of our impact to date. We think in the next year, we're gonna hit 1 million applications submitted in all the states that we work, across all the states that we work rather. We work in New York City, Pennsylvania, Maryland, North and South Carolina, as well as Colorado. That's where we have outreach projects, although we certainly do policy work and other types of partnering nationally. Here's some stats from 2019. We're expecting 2020 to look like a very busy year. Again, just given everything that's going on, we've certainly been busier. We've submitted more applications to this point this year than we had last year. And we are also seeing a critical metric increase in that more people who call us end up being likely eligible for these programs. So again, that suggests that, that really paints a picture of how the impact of the pandemic is affecting households. Folks that, might not have been eligible 6 months ago now are because of how their income has changed. So that's certainly that's part of the story of 2020 from our perspective. So yeah, back in March when the pandemic hit, like everybody, we adapted, with the central goal of being able to serve our clients now more than ever when public benefits were needed at new rates. I mentioned we were already, lucky to be set up in a way that we were delivering our services remotely. We had always done our work over the phone, but we did, of course, have a headquartered office. So we needed to think through the safety of our staff. We were able to get everybody home to continue services over the phone. Everybody is working remotely right now. But again, we were lucky to be able to just make a couple of tweaks and continue services as planned. We've had to be really mindful of how policy changes on a federal, state, and local level affect how we accompany clients through the application processes. So we've had to adjust certain types of application steps to align with changing waivers and permissions flexibilities that have been coming down. And then certainly this policy and practice work, there's been no shortage of opportunities to collaborate across the board and really highlight best practices for this moment. So I think that's where I'll end is around these best practices. Here are a couple that I'll talk through that we have found from our particular experience, understanding that there's a lot of expertise in this field. There's a lot of really important ways to help people navigate application processes, but this is what we see from where we stand. One is really that critical proactive piece of leveraging data to identify people who might be eligible for programs. There are a lot of ways to think about this. You know, there might be a food distribution program from which there are people who could be eligible for SNAP but are not yet enrolled. How can we think of that as, you know, people who have enrolled in that emergency food program as a source for outreach to let people know about these additional resources? And when we're outreaching, we really like to think about using varied methods to increase the chances that we actually connect and support a person through an application process. At BDT, we do a lot of mail-based outreach. We also send a lot of text messages and of course do a lot of work over the phone. So we see and we study very closely, you know, is someone responding to a letter quicker than a text? What is the difference between, you know, when our first text comes out and someone responds versus the second text, you know, thinking about the timing and of course the messaging of the different things that we highlight in our outreach. Also important to keep in mind that people have different needs and preferences for how they would best navigate these processes. I mentioned in-person support is critical. A lot of folks really depend on those resources in their communities. With that, you know, being challenged right now, it's important to think of other options, including phone-based and online support. However, that's helpful. Often it's a combination of different ways of supporting people through these processes. And lastly, you know, we always have an eye on these streamlined enrollment opportunities as highlighted in the policy brief. At any given time, but particularly now, there are opportunities to make things a little bit easier in common sense ways that still protect the integrity of the programs. And so we really do try to have an eye on that. I think we're going to have some lessons learned from things that we had to try out of necessity, things that agencies had to try out of necessity during the pandemic that might be good fodder for future improvements to program administration. So I will stop there. I think I saw a couple of chats come through. I'll check there first, but I really would love to open it up for conversation. Oh, okay. Thanks, Katerina. Katerina said, can you elaborate on how data has helped enhance your organization's client-targeted reach and service? Do you also track client expiration dates and help remind them of applications? And finally, do changing policies and requirements make your, yep, okay, awesome questions. Thanks, Katerina. So data is a really critical piece of the work that we do, kind of from start to finish. Sorry, I'm going to close out of presenter view. We have a very kind of proactive way of identifying who is likely eligible for programs. We partner with different agencies and enter into data sharing agreements with them to identify securely and of course within the proper protocols through these agreements who might benefit from an outreach from us. And then, you know, we're always speaking to clients who choose to call us. So people then are receiving that message and making the choice to call our contact center. And then, you know, throughout the process, it's really important for us to track, you know, what was the outcome of a particular interaction? Did they eventually enroll in the program? And if not, what were the challenges? What were the reasons that they didn't? Do we track client expiration dates to help remind them of their applications? We do to an extent. This is a place that we've been focusing more just because the need is so great and the requirements for this are changing in light of the pandemic. To use the example of SNAP, you know, most people do need to recertify every 6 months. So there is a way for us to get a sense for whether or not their expiration date is coming up and to point them in the right direction. And then also, if we are working with a client for the first time while they're trying to recertify, we're able to kind of work with them to understand what steps in the process they have left. Lastly, do changing policies and requirements make your work difficult? And how do we ensure we're up to date on all these changes? It certainly is a challenge to keep up with all of the information coming from different sources. From my perspective, working on our New York project, the Department of Social Services has been very proactive about the information that's been coming down from a federal perspective and changes in eligibility. So, we tune in where we can. We kind of ask around to our partners to understand where we should be tuning in. And we make sure that our policy team is well aware of this. And they then have the perspective of how should changing policy considerations affect how we take people through various processes. So we're very attuned to that. We don't want to be giving people bad information, especially now.
Thank you.
Thanks for the questions. Appreciate that. Okay, question from Bill. What do you think about a negative income tax based on guaranteeing every individual and family a living wage income? Great question, Bill. Thank you. I could see us spending a lot of time debating this in various SEPA classes, so I appreciate it. In general, I think there's a lot of appeal to universal programs. I think there are, and certainly tax-based considerations are ones that are somewhat familiar to the American public. So thinking about how, a tax-based revenue would support a certain type of outcome. As far as a negative income tax specifically, I think it's a great idea. I think it's a question of making that connection and gaining consensus about, should something like a universal income be funded by a tax revenue source? Again, I would be all for it, but I think there are some considerations when we think about how that could be administered, especially because, again, I think we've seen in this country a reticence toward universal programs in general. Universal basic income is all the talk right now, but it's complicated, and I'm not sure that our psyche is primed for that. But that's maybe being a little negative or a little pessimistic. But I personally could see it working well.
Well, we already have the low income tax credit, right? So we already have a program that provides through the tax system some benefit for people who are in the lower income bracket. I think this is not a new idea. It's been around for a long time. My own belief is that it's a far better solution than minimum wage, because minimum wage puts the burden on particularly small businesses and startups and all the people we're trying to encourage by telling them, you got to pay at least this, whether you have the revenue to do it or not. And then they're faced with hiring less people, not hiring someone, where if you let the market determine what wage is, but then we as a society say, work. If you're working just like everybody else, you should earn enough money. If the economy needs people to run grocery stores in the middle of the pandemic, then those people shouldn't have to risk their lives and get paid not enough to live. That's something. Just if you're essential, for God's sake, you probably should be making more than the job is worth. If we're saying as a society, we need you to go to work while everybody else needs to stay home. Anyway, it's been a pet solution for mine since the beginning, because I think one of the things that's strong about it is it doesn't restrict the economy. If anything, it subsidizes the economy. It would create jobs, not reduce jobs. It would enable small businesses to do better. But I couldn't resist. I'm sorry.
Yeah, no, I think that's the sweet spot. Exactly what you're saying. That counters all of the potential challenges with it. The earned income tax credit does exist now. It's underutilized. I think that was on one of my slides. But in a similar way, thinking about should tax revenue? Is that just kind of a natural point to think about different types of redistribution? I certainly think so. But to your point, I think it's a lot about the packaging and making the connection between what the program does and kind of the world vision that we have for what a program like that could do.
Thank you.
Thank you for the question. Love it. Let's see. Sarah, thanks for your question. Do you have any outreach to people who might be afraid to apply for public benefits because of the public charge rule? Yes, absolutely. For those who aren't aware, the public charge rule is specific. Well, I know most about it in terms of SNAP. I know it also currently applies to the Medicaid program, but over the last year from the Trump administration, there had been some proposed changes, some of which went into effect, some of which were withheld, some of which went through. There's a lot of nuance, but basically how it works is that with parts of what was proposed, individuals who had certain citizenship statuses, there is a chance that their past receipt of public benefits could affect various steps of their immigration application process. So there was a lot of confusion about this, a lot of messaging around it, and certainly we spoke to plenty of folks throughout the course of the last couple of years who were concerned about this potential impact. The way that we addressed it was really to just stay really up to date with our partners who are experts in this. The level of complexity really does come down to the type of thing that an immigration lawyer would understand the best. So we would get our talking points from them. Our policy team would get trained and then train our team to make sure that our folks on the phone felt empowered to give enough information, as much information as we could. But the real challenge was that it was hard to say exactly what was going to happen. A lot of the proposed rules, depending on how they shook out, would have certain impacts or would not have certain impacts, but there was a long period of time when people just didn't know what was going to happen. So we had to be really forthcoming about that and just give as much information as possible. And we relied a lot on referrals to other experts in this field that we would give clients for more information. So that was certainly something that we tracked, we keep tracking, and we were sure to make sure our folks on the phone felt comfortable having those conversations. Thanks for that question. From Paul, do you have ideas for the future to tackle ongoing digital divide and overcoming the language barriers in many communities? In addition, do you have any opinions on direct cash assistance programs similar to the stimulus checks? I'd love to start with the second. I thought the data that the Columbia School of Social Work put out, as well as many others, is so compelling to the end that, when people have cash to deal with their daily needs, even if they're up against serious challenges, they're going to make great decisions for their household. And we see that dip. We see that actual dip in poverty when people have the liquidity to make decisions about most urgent matters. So I think that was a really promising finding from that particular cash transfer. One program that exists in the US that is most similar to kind of a cash transfer is the Temporary Assistance for Needy Families, or TANF program. In New York, it's called Cash Assistance. It is very hard to qualify for. But if you do, you meet the rigorous qualification standards, it is also well documented that families that have that benefit are able to make these types of calculations and decisions that reduce kind of the impacts of their situation. So I do have some opinions about cash assistance programs. I think I wrote about it extensively in Yumi's class when I took it. I think it's a promising thing that maybe we see examples from other countries, and maybe now is the time to seriously consider broadening existing programs or even inventing new ones. Do I have ideas for the future to tackle the digital divide and language barriers? It's a really great question. Certainly, there's a lot of opportunities for that as it relates to social programs because of the tendency to see online applications as kind of the silver bullet. I would love to spend a lot of time talking about this actually, but the one thing I'll say is that the pilots we're seeing with different apps and different partnerships, thinking about how can we smartly, securely, and with full consent, share data within agencies to reduce the burden on individuals. These are all things that we can think about. How do we keep people informed and in ownership of their data, but also to leverage it to make it easier to enroll in the programs that would benefit them. Those are a couple of things that come to mind, but would love to hear any thoughts from the group on that one if you want to put them in the chat. Okay, one silver lining has been that some enrollment systems have been streamlined. Could I elaborate? And what do I see as the justice systems? So one that comes to mind for the SNAP program is that states had flexibility to waive the required interview for SNAP, and New York City did take that up, and they were very thoughtful and progressive in how they did that. There are mixed ideas about the effectiveness of the interview. There are some people who think that the interview is a really good opportunity to educate and make sure people are clear about how to stay enrolled in the program, and I totally see that point. But in general, from what we see on our end, more often than not, the interview is a challenge to complete just because of the logistics, really. Often folks will apply and then they'll get an appointment in the mail about when they have to be ready for a call that's probably coming from an unknown number, and maybe they didn't get the letter in the mail, and maybe something changed, and maybe they didn't pick up the number because they didn't recognize it. Next thing you know, they have to start from scratch. So I think it was very smart to take advantage of that particular waiver, which just said, hey, submit your application. Not everyone is going to have to do the interview. Only if there are questions will someone follow up with you. We've been hearing from clients as well that has alleviated some of the burden. Another one I can think of is for the Wic program. They eliminated the in-person requirement. So to apply for Wic, you had to formally go in person to have at least one appointment, and then ongoing. Understandably, that was eased for now. Again, I think there's a lot to consider. There are some benefits from that in-person connection from an education perspective, but in terms of just getting the benefits to people who need them, removing that requirement during this time, I think made a lot of sense. And so I think we have a lot to learn from when we think about these programs in the future. Yumi, hi. Love to hear your thoughts on the boom in disability insurance in the last few years. Is this an inter-policy dynamic, for example, the disability access benefit affecting SNAP enrollment? So in other words, Yumi, is this kind of a question about shortcomings of one benefit increasing enrollment in other benefits like disability insurance?
Yes, that's correct, yeah.
I definitely think so, and I think that's probably a natural consequence of a lot of these programs being so disparate. I don't mean to suggest that all of them are. Some benefits are linked closely. There's a pretty close connection between SNAP and Medicaid. There are a couple of links between SNAP and free and reduced school meals, for example. But yes, I think those kind of downstream effects of, someone's not able to pay for groceries, and that deteriorates their health, and so therefore they now need to apply and qualify for disability insurance. I think that certainly happens. I can't think of any studies off the top of my head that document that specifically, though I'm sure they exist. And I think disability would be a good place to start to think through some of those intersections for sure. Okay, and I'm seeing one more question here. I'm keeping an eye on everyone's time. These are great questions. Thank you. I would love to talk with you more about them. I spoke about the relationship with separate agencies. In your experience with these agencies, is there anything within any government agencies that provides similar support? If not, do you think it would be better existing within or outside of government agencies? Okay. I think that's a great question because at least from BDT's perspective, we always want to be in support of what government agencies are already doing because we don't want to complicate these systems even more. So technology does come to mind there. You know, if there's a really great benefits screener tool out there, we don't want to replicate that because the government agency, if they've taken up a project like that, are going to be best positioned to upkeep it, to keep it accurate, that type of thing. I want to make sure I'm getting at your question though. Provide similar support. Yeah, from my role as kind of a partnerships person, a relationship management capacity, it's really exciting to work with different people in different agencies. Certainly we are interfacing often with people who do partnerships work, kind of like public-private partnerships people, P4s, I guess in that case, for the agencies. But also we get to talk to the, caseworkers oftentimes, and different folks within organizations have different needs. So I think when government agencies have dedicated people thinking about partnerships work, external partnerships work, it's usually worth their while. But there's a lot of ways to approach things, especially when you have subject matter experts and a lot of opportunities for collaboration. Does that answer your question? It was like a reading and responding thing.
Yes, partly. I guess it wasn't really that clear. I think what I mean is, in your experience with the government agencies, has there been anything in the past that unifies all of them? I know that you were saying that there's issues with these overlapping programs and people who need access to many programs, and there are so many barriers to them accessing that because they're all disparate. And that's where you come in, right?
Mm-hmm.
And I guess my question is, do you think that the partnership, the nonprofit sphere is better off handling that because of the expertise, because they're kind of outside of the budget constraints and the interagency rivalries and that kind of thing? So there's two questions. Has it existed before? Does anything in the government unify them? And also, do you think it would be better served in the nonprofit sector?
Mm-hmm. Gotcha. That's a good question. I think there are fantastic examples of interagency collaboration, and you'll see in certain city and state governments, often there will be like an office that coordinates on, innovation or poverty policy or something interdisciplinary like that. I would say that's a really effective model if the state, city, et cetera, has the resources to do that. Just because, again, you're getting information straight from the source when the agencies are able to collaborate, directly. There's also they can get a little bit creative about how they partner on projects. If it's a technology project or a targeted outreach project or something like that, there's strength in the agencies being able to work together. I think a lot of folks in nonprofit joke that if we do our job well enough, we'll work ourselves out of a job. And I think that really is true. I think we have some flexibilities as a nonprofit to try new things, to pilot things, because we don't have the same type of budgetary or political constraints. And hopefully that can be an asset to the agencies that we partner with. But we have our limitations too, understandably. So I think that part is a both and.
Thank you so much.
Great. I hope I answered. Please give a shout if I missed a question in the chat. Or if you would prefer to speak a question, I welcome it. I know we have just a few more minutes here. Great. Well, I thank you so much for your time. Such a privilege to be with you all and to talk about this work. I really enjoyed it, really enjoyed these questions. Please feel free to reach out. LinkedIn, I think I might have briefly shown my email, but maybe I can pass it around via Jeremy or Valerie if you're interested in any follow-up conversations. BDT is on Twitter. We've got a newsletter as well. You can subscribe on our website. And truly, yeah, thank you all for the work that you do, the studies you do, and hope to keep in touch.